Beccy Cooper.
Thank you, Chair, and thanks for coming along this morning. So I'm going to carry on from where Layla left off. So I've heard you sort of mention capacity, commissioning and consistency, all very important things. And I just want to sort of focus the discussion around how health bodies are doing in this area compared to local authorities and education. So the Education Committee found that health bodies aren't actually pulling their weight in this area. And I just wondered if that's the experience that you've found speaking to parents. So I don't know who'd like to start.
Well,
Anna, would you like to start?
Certainly happy to talk about what we hear from parents, which is that the health elements of an education, health and care plan are often the bits that are not being delivered. That is certainly what we hear. So there is a sort of sense that the health bit is not pulling its weight. There's less of a lever to kind of ensure.
And do you get a sense of why that is?
So, I think there is something about the way that education, health and care plans are constituted at the moment. So Section G of the plan, which is kind of the healthcare bit, doesn't have the same statutory force as Section F, and that is a kind of big problem. What we see in Section G of a plan is often, as others have said, quite unspecific. So it can say speech and language therapy, but it might not say by whom, for how long, how much of it. So all of that makes it quite difficult then to enforce that part of the plan. So we certainly hear that from parents all the time.
Okay, so it's something you've heard. Would anybody else like to comment?
Just thinking about that health element of plans as well, from a speech and language therapy point of view. Speech and language therapy is often written into Section F as well. Any provision that educates or trains is seen as a special educational needs provision. So just broaden that, it may, the assessment might have been by a health professional, but it will come into educational provision as well. Holden.
Sorry, just to go back, you've mentioned that before about the commissioning issue, that basically people aren't commissioned to go into educational settings, so that's a problem.
There's variability around that.
Okay.
Some services, some speech and language therapy services will operate a clinic-based type model and do specific assessment and treatments in a clinic. A lot of speech and language therapy services will work at place in schools and settings. There is the capacity of the workforce to be able to do that across every school and every early years setting as well.
So, and just to come back to that, so do you think there's capacity within the healthcare system to do what needs to be done in these EHCPs? Do you get that sense? No, Dr. Payne, you're shaking your head. Would you like to speak?
And I'm sure I'm not just speaking for occupational therapy, but services are incredibly stretched. We've got professionals who are working really hard and want the same as parents and families, which is to do the best for children, young people in the education setting. But the demand is huge, and also services have been delivered through a real patchwork of different models. We've got occupational therapists who work in NHS core services. We've got provision being provided by local authority funded occupational therapists, by independent practitioners, and we've got that real challenge around that inconsistency that we've mentioned previously, and I think that model's pretty unsustainable.
Okay, so it's it's a broken commissioning model by the sounds of it. People are doing different bits in different parts of the system.
I think it's a lack of coordination, lack of accountability.
Okay, so how can we improve that accountability? You've talked about patchwork commissioning. Do you think integrated care boards becoming strategic commissioners is going to be a good way forward, because they'll be responsible for much more strategic health commissioning? Do you think that that's a good idea?
I think integrated commissioning is certainly something that needs to happen between ICBs and local authorities for children's therapy services. That's certainly got to be a starting point.
Okay, and just to be clear, ICBs, actually local authorities don't sit currently on the board of ICBs, but you think that should be much closer, that working relationship?
That collaboration, that multi-agency working is part of where it's falling down.
Okay, and how else do you think we can improve the sort of accountability of that health part of the EHCP?
I mean, so from our point of view, certainly it is about joint commissioning. It is about kind of that integrated approach. It starts from the top, and I think we need to see special educational needs being a higher priority right across the health service. So,
you don't think it is currently?
And it isn't now.
And why do you think that is?
for all sorts of reasons, but there are many priorities in the health service. I mean, I think we haven't seen that in the 10-year plan. What we want to see...
Sorry, just to be clear, you don't think that these issues, this commissioning, is highlighted sufficiently in the 10-year plan as it currently stands? Okay.
No, and what we want to see is a clear kind of workforce, in the 2026 workforce plan that sits alongside the 10-year plan. We want to see a specific strategy for the workforce around SEND. That's what's needed so that we can actually...
You're talking about the health workforce around SEND?
Health workforce
okay, and do you have any sense of... Because so the commissioning will go ahead with the workforce as it currently stands. So am I hearing that even with good commissioning, we simply don't have the workforce capacity to deliver what is needed? Is that reasonable? Yeah,
certainly when I sit in tribunal discussions with regard to cases coming up, and we are liaising obviously with health, whatever's written in the plan is fine, but actually there aren't the people on the ground to actually deliver what's in the plan. So we're all in a lose-lose position, because actually even if we say this is what is in the plan, we've managed to get the advice, we've managed to put something together, but actually there isn't anyone to deliver it. Then, and particularly I want to highlight as well, we really do not get any information from aspects of health such as CAMS, which can be vital to an education.
Sorry, to be clear, you don't get any report, or is that a GDPR issue? How does that work?
I understand, obviously, as an educational psychologist, we don't need detail necessarily with regard to why children may require CAMS input. What we do need to know is what provision they require, as in whether is that therapeutic input, is it adjustments within the school system, but actually getting any information from CAMS. It was one of the most reported difficulties from all the Senate officers that I reviewed.
Sorry, do you know the reason why you don't get the information? Is it an administrative issue, or is it a GDPR issue?
There's never been a reason given as to why we can't get the information.
Has anybody ever
CAMS.
asked?
Yes, because we do, particularly when we're going to tribunal, because we're trying to make sure that we have everyone around the table, but getting any information from CAMS colleagues can be incredibly challenging.
Sorry, just to be clear, the reason they give is...
It tends to, we don't tend to get a response.
So you say, can we have the information, and they don't say anything?
Yeah, I mean, obviously we're generalising here. There will be some CAMS practitioners, my colleagues in psychology, that actually will provide, but it's very limited. And the officers, it was the most consistent thing, is that getting information from CAMS was the most difficult area.
And I hear you. And I just want to be clear that there's no actual reason, as far as you're aware, why they can't give you the information. There's no sort of legal reason or data protection reason.
Like I say, I think it's that we don't want to know the detail. We don't need to know the detail of why that young person might need CAMS, but what we do need to know is what that provision needs to look like. So is it that we need therapeutic inputs that are on a weekly basis, or is it that we need, and that we're not getting that
You're not getting that, is
not
what you're
getting
saying.
that, no.
Right, interesting. No. Peculiar. And... And just finally, and then I'll hand back, just to be really clear, if there is no increase in workforce in this area and the commissioning becomes much better, is there another way to work smart with the workforce that we currently have, do you think? Dr. Payne, what do you think?
I think there is some possibility of repositioning some of our workforce. There's been that focus on early intervention prevention work. But if you've got a service of 3 members of staff, you've got much less capacity to reposition your workforce because they're not there. If you've got a workforce of 10, 20, then that's a possibility. But I think that investment will be needed, certainly.
Okay, thank you. Thanks.